total, and we have about and then we have about 1,150 smaller service points all over the country, all right? Now, the top 10 causes of death in Namibia divided into HIV and AIDS, ischemic heart disease, lower respiratory tract infections, CVA, which are your strokes and your transient ischemic attacks, TB, tuberculosis, your neonatal disorders, your diarrheal diseases, DM, diabetes mellitus, COPD, which is your chronic obstructive pulmonary diseases, and then you have your road injuries, which also accounts for quite a large percentage. All right. So there has been a significant progress in health in the Namibian healthcare since independence. Now, this can be seen through our key indicators, as we have noted a massive improvement in these indicators as a result of the government's investment in the health sector. Right, so it's very easy for us, because I think a lot of people constantly think that, look, the government is not doing everything that they can do to ensure change. There is so much room for change. How can we ensure this change? The government isn't doing it. We need to do it on our own. But as much as we would like to criticize, it is very, very important for us to be level-headed and understand that there has been progress in the health system from independence in Namibia. All right, and this can be seen as the percentage of fully vaccinated children from the ages of 12 to 23 months increased rapidly from 57.9% to 64.8%. That was in the year 2000. And then the percentage of women using modern methods of contraceptives increased from 21% to 37%, which is also quite a massive jump, especially in the health sector. Between 1991 and 2001, the mortality rates for infants fell the mortality rate from infants, fell to 52 per 1,000 live births. Now, this are major, major, major improvements. And also, I don't exactly remember why I put this point here, but I believe there is a reason why I placed it there, so I will mention it. The first Black woman medical doctor in Namibia was Dr. Libertine Amadila. I'm not sure why I put that there, but especially in this particular time where we are saying Black Lives Matter, I definitely believe there's a reason that is there. And so keep in mind that she was the first Black woman medical doctor, obviously paving a pathway for people like me to be able to come about and say, look, you know what, we have a voice and we are able to come into the sector boldly and speak and advocate for change. Now, moving on with our fact sheet, after Namibia gained independence, its healthcare system unfortunately still reflected a very traditional approach to healthcare. Now, when we say a traditional approach, what we're basically saying is that they focused on curative services. Now, the difference between then and now is that we've moved from focusing on cure patients, treat patients, manage conditions, to how can we prevent these conditions? So yes, we have these 10 major causes of mortality in Namibia. How can we address these to ensure that we minimize these before they even occur, so that we are not acting on the current situation, but we are acting to prevent the current situation from reoccurring for our future generations? Now, the health outcomes were poor, as well as there was a very, 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 very diminished amount of access to quality health care. Now, that was reflected in the traditional methods of healthcare. So in response to the traditional healthcare, what the newly formed government did at that particular point in time is they tried to address these issues by remodeling the primary healthcare system. So the healthcare system that we see today, whereby we have healthcare workers going out into the community and advocating for change and advocating for women to take control of their health and use contraceptives, and advocating that if you have HIV and AIDS, you must ensure that you take your ARVs. If you are a mother and you are infected, you must ensure prevention of transmission from mother to child. So this entire system was introduced by the new government, that is post-independence. Primary healthcare then targeted 4 main points. So if you see any healthcare system today, whether it be Namibia, whether it be in South Africa, whether it be in any African country or the world at large, majority of the times, these are the 4 things that they are working to improve or to implement: health promotion, disease prevention, curative services, as well as rehabilitative services. Now, these 4 things are very important to remember because ultimately they mold the entire healthcare system of any country. So unless you have a balance between these 4 things, majority of the times the healthcare will suffer. Either the healthcare workers suffer or the patients suffer, one of the two. And so it's very, very important that healthcare workers, whether you're a doctor, whether you're a nurse, whatever it is that you are doing within the healthcare sector, it is important to understand the importance of each and every single one of these factors and your role in it as well. Now, in order to reduce the inequalities in access to quality healthcare, the government that was introduced at that particular point in time introduced a public-private partnership. Now, this that I'm mentioning is just one example of many, 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 many examples, all right? But because of time, I'm going to limit the examples a little bit. So they introduced a public-private partnership between the Ministry of Health and Social Services, Farm Access, as well as the shops, the USAID shops. Now, these implemented what they called the Mr. Sister mobile clinics. Now, what these did in very simple terms, I'm not going to get very technical, but what this particular initiative did is that it assisted with immunizations, antenatal care, health education, as well as others. So whereby you had a system that was focused on treating people that come with your CMV infections and all these other infections that you can actually prevent, we then started saying, okay, listen, this is the immunization schedule for children at birth. They need to be immunized at a certain number of weeks, at 10 weeks, at 14 weeks, they need to be immunized, at 9 months, they need to be immunized. And this is the immunization schedule that ought to be followed in order for us to ensure that we decrease the neonatal mortality. So the Ministry of Health and Social Services also provided a lot of community outreach services, such as campaigns, family planning, as well as rapid HIV testing, okay? Also important to note is that the expenditure of health increased very rapidly from 6.2 of the gross domestic product to 8.9%. Now, this is a huge leap from a system that previously was only focused on ensuring that we treat current conditions to now a system that is attributing up to 88.9% of its GDP to health. That is very, 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 very massive. And so we move on to what I am very, very excited to talk about, very passionate about, as you've probably noticed. One of the things that I like to mention is that there is no development without its areas for improvement. All right, that's very, very important to understand. And as much as we have areas whereby we ought to praise a system, we also have the raw truth, whereby we ought to say, all right, these are the things that we need to address. And that is the only way that any system develops, whether it be your economy, whether it be the tourism industry, whether it be health. It is important that as far as possible, we are honest, not only with the community, but honest with ourselves as far as reasonably possible, such that we can say, all right, this is where we are right now. Where do we want to go? And how exactly do we want to get there? All right, so I'm going to pose 4 questions, and I've modeled it a little bit differently. I'm not going to answer all these questions. I probably won't answer any of them at all. What I want to do is provoke every single one of you to thought. I want you to listen to the questions, and I want you to analyze based on what you know about the Namibian healthcare system and the African healthcare system at large, and make a decision for yourself, an informed decision on what you think the answer to these questions are. Because one of my roles as a health advocate is to be a catalyst for change, meaning that I don't tell you how to think, but sometimes all I do is pop in a thought and allow you to think and process that for yourself such that you can make an informed decision. And if you are in a position of power or in a position whereby you are able to afford change in one manner or another, you can then use the information that I have afforded you to be able to make such informed decisions. Question number 1. With a population of 2.5 million, is it possible to achieve quality healthcare for all? Taking into consideration that Namibia is one of the least populated countries in Africa. So with a population of 2.5 million, is it possible to achieve quality healthcare for all? Question number 2, is the Namibian government doing all it can for the healthcare system? Question number 3, what is the role of Namibian doctors in the field of global research? Now, I will expand on this question just a little bit to say that when I talk about global research, what I basically mean to say is, are Namibian doctors and healthcare workers at large as actively involved in research as they should be? Currently, we have the whole COVID-19 situation taking place. Are Namibians actively involved in finding a vaccine? Now, this is very important because you have a situation whereby I will speak later about the future of Namibian healthcare. So it's important to ask these questions because the future involves a lot of technology. The future involves a lot of work with specialists. The future involves a lot of research work. So we need to ask ourselves how far Namibian healthcare workers are really actively involved or part of global research. And if you think that they are not as actively involved as they should be, what can we do to improve that? If you feel that we are actively involved as far as reasonably possible, can you back that up with statistics and valid information? Question number 3, what is wrong with the Namibian healthcare sector? Is it a lack of funds? Is it a misappropriation of funds? Is it a lack of patient education? Is it a lack of dedicated healthcare workers that understand how to best utilize our resources? And once again, I will expand on this question because when I talk about healthcare workers not being able to or not being knowledgeable on how to best utilize resources, we have a situation whereby you have new doctors that come into the healthcare sector, and because of the fact that they don't necessarily know quite how much things cost, you have a doctor that will need to investigate a patient for a liver condition, a liver pathology, and they order a whole bunch of tests that have absolutely nothing to do with the diagnosis. And if you are actively involved in the healthcare system, particularly where administratively you understand how much these tests actually cost. So quite fair enough to say that, all right, the government needs to allocate more funds to the healthcare sector. Is the government allocating enough funds and all these things? But then you need to ask yourselves how far healthcare workers are going to ensure that we best utilize the resources that we already have. All right. And then we have the final question, which says, how does Namibia go from being where it is right now to being where we want to be in the healthcare sector? So we all have some sort of idea that this is the Namibian healthcare system. These are the things that we are struggling with. This is how far we want to be in 10 years' time. But the question always remains how. Because fair and well, everybody has an idea of the fact that the healthcare system in Namibia should be doing much better than it is. Quite all right, we only have a population of 2.5 million people, and Twitter is always going crazy about how we need to ensure that our hospitals are cleaner, we need to ensure that our healthcare systems are more accessible to people in the rural areas and more disadvantaged people. But then you pose a question and you say, how? You see, because if you're going to address the flaws in a system, it is important for you to have some sort of solution, not necessarily a complete solution, but some sort of a suggestion to say, listen, this is what is wrong with the healthcare system. And I propose that, is it possible that we address it in this manner, and that manner? So those are the 5 main questions actually, that I'd like to leave you guys to as we move on. Now, when we talk about the healthcare system, one of the things that I like to do is applaud those that need to be applauded. Now, this is very, very important. I'm going to move back to my previous slide before you all read what I was going to say before I say it. Now, I like to applaud people that are doing well because I believe that it opens ground for those that are coming in future generations to feel empowered to be able to do the very same. Because if a upcoming doctor that has just graduated from the School of Medicine has said that, okay, listen, I would like to fight for quality healthcare, and they see, well, there's somebody else that's doing the exact same thing, and they have platforms where they are able to do this, it then automatically allows that person to say, listen, these platforms have been created, the road has been mapped out for me to be able to take this into my hands and say, listen, this is what I can do. In the Namibian healthcare system, look, I know that the list that I created because of time I only chose two particular people in the Namibian healthcare system that I'm just quickly going to touch on and applaud them for the fantastic work that they have done and are doing in the Namibian healthcare system. This does not in any way mean that I do not recognize the work that is being done by other Namibians. I acknowledge the fact that we have hundreds of medical doctors that are going out of their way every single day to ensure, not only medical doctors, pardon me, health technologists, pharmacists, and people that are going out of their way to ensure that they fight for the healthcare system in Namibia. But I would like to particularly applaud these two people. Number one, Dr. Helena Ndume. Now, I have worked very, very closely with her. Anybody that knows me knows that my journey has been very much influenced by her. She is someone that I look up to not only as a medical doctor in her capacity as an ophthalmologist, but also because of the character that she has introduced in the Namibian healthcare system. And one very important thing that she always says is the importance or the need for healthcare workers to see or to recognize a gap and jump in head first. And this is what she has been able to do. Of note, she has saved over 30,000 Namibians with eye surgery as well as intraocular lens implants. Now, this is noteworthy because we have, like, as I've mentioned before, we have a lot of people that are able to identify the gaps within the system and say, okay, listen, we have Namibians, especially per se in the north of Namibia, over the age of 50 that are in need of eye surgery, but how we get these services to these people at no cost at all is beyond us. And then you have people like Dr. Helena Ndume that comes in and says, listen, my team and I have recognized this gap, and this is how far we are willing to go to ensure that over 30,000 Namibians are afforded this treatment or this care free of charge. And then we have Lloyd Ushona, who is someone that I've only actually gotten to know in the past year. Now, she's a biomedical scientist with about 14 years of experience that is shared between her and her business partner. And they're both biomedical scientists. And together what they have managed to do is open the youngest medical laboratory in Namibia. Now, the reason this particular medical laboratory is of note is, number one, apart from the fact that it is the youngest medical laboratory, also important to note that it is the only facility that incorporates research and innovation. This is very, very important because, as mentioned in one of my questions, is Namibia and healthcare workers doing enough to ensure that they are part of the global research? And then you have people like her in a totally different age bracket to Dr. Helena Ndume, who says, listen, this is the gap that I've recognized in the healthcare system, and this is what I am willing to do to ensure that I affect change in the system in one way or another. And when we talk about the future of healthcare, I am very much in love with the course that I'm doing right now. When I was introduced, he did mention that I'm doing a master's in business administration with a focus on healthcare management. And I jumped into this headfirst, as I always do with everything. But one of the things that I've come to understand is this is probably one of the best decisions I could ever have made. Why? Because it has allowed me to understand just how far healthcare and technology really go hand in hand. And unless any system, whether it be Namibia, South Africa, Kenya, Zambia, Tanzania, Mozambique, or even outside Africa, unless we understand how interlinked healthcare and technology really are, we will continue to remain behind. So when we talk about the future, all right, point number one, very bold statement that I'm going to make, all right? Remember I said I do not like to address things in their typical manner. So this again is one of those examples. I will make a very bold statement. We should not be filling patient admissions in paper booklets anymore. That is still currently happening all over. That is happening in Windhoek, that is happening in the north of Namibia, that is happening in the various regions. I will bring quite an interesting example to the table. If you are a healthcare worker, and if you are not a healthcare worker, you have probably made use of the series Grey's Anatomy. And although a lot of people always criticize and say that, look, it's very unrealistic, I'd like to draw your attention to the fact that every single time they have a patient come in, they're not recording the patient's detail on a piece of paper. They're recording it either on a tablet, right? Or some sort of, whether it be an iPad or whatever it is. Now, this is not for the sake of looking fancy. This is important because every single time a patient comes back to that very same hospital, what it allows you to automatically do is to type in the patient details, and automatically you have access to their previous results, you have access to their previous file, you have access to their previous doctor's notes, and automatically you're then able to compare and say, all right, listen, this is what this patient came in with last time. If this patient has acute kidney injury in May 2020, now we are in August, and I can automatically compare the urea and the creatinine of this patient instead of starting from the very beginning, baseline again, and saying, okay, this is a patient, we don't know if they have kidney injury or not. Let's start from the beginning. And automatically what this does is it takes us back. Because what the rest of the world is doing is they're moving with technology, and they're saying, listen, what we're going to do is that every single time a patient comes in, because of the fact that we have their information stored, if Amanda comes into Onanchokwe Hospital, automatically I can say, all right, these are her details from the previous admission, and I am then able to better utilize my resources, especially in a developing country like Namibia, whereby we mentioned we don't have all the resources that we need right now. So it is very important for us to acknowledge the fact that we need to better utilize our resources, and redoing tests for a patient that we have already seen is not a good use of resources. So with subject and task-based systems such as electronic medical records, the electronic medical record basically replaces the paper trail version of a patient's medical history. So the electronic health record basically includes health data, test results, prescription results, and what it does is it basically forms a well-structured information system that is more productive, and it basically allows healthcare workers to keep better track of their patients. Now, in an advancing healthcare system, all right, we have a situation whereby, especially in Namibia, when I am called to the hospital, for example, I have a patient with DKA, right? Diabetic ketoacidosis. I need to monitor this patient very very closely, right? Because this is an emergency. I need to ensure that this patient is getting the correct fluids. I need to ensure that this patient is getting the correct medication. I need to ensure that the rate of insulin is correct. And I need to be able to monitor their AGT levels, right? Their glucose levels, to ensure that I optimize this patient as far as reasonably possible. Now, what an advancement in the healthcare information system, or advancement in technology, literally allows us to do is that it allows nurses from the nursing station, while I myself as a medical doctor am in casualty seeing another patient, if I'm connected to the same portal where the nurses are connected, what that automatically allows me to do is it allows me to access the update of my patient from wherever I am. So if I am the doctor on call, the nurse is then able to update and say that the last AGT, or the last glucose level that was done at 3 o'clock was 10.7. And I am then able to say, all right, please reduce the insulin levels or the insulin infusion to this level. And she will then automatically receive my instructions without me having to leave one emergency and go to another emergency. Now, these are the sort of systems that are being implemented in other parts of the world, which would do the Namibian healthcare system a load of good. Okay, in emergencies, as mentioned, this system is highly effective as the attending physician is able to order emergency management for their patient. Now, this also allows attending physicians to make a patient's record available to other doctors when requesting for consult. Whereas in today's age, what we need to do is write a referral letter, whereby I now need to document from scratch. This is a 16-year-old female who is a type 1 DM diabetes patient, newly diagnosed, make an entire summary on an A4 page, whereas I can just have the doctor that is going to consult on that particular patient have access to my patient portal. By giving them access to that portal, they're automatically able to see everything about this patient, from when the patient came in, from what her initial lab results were, from the management we have offered this patient, and the consulting doctor is then able to say, all right, you have given the patient 1 liter of normal saline 8 hourly. It should be 1 liter 12 hourly. Kindly adjust your insulin levels to this, and this, without having to go through the entire process of saying, okay, you know what I'm going to do is write an entire referral note. So this is just one of the examples, right? When we talk about the progression and the advancement of the Namibian healthcare system in terms of the future healthcare system. Another important example of health information systems, right? When you talk about patients, are patient prescriptions. Now, this is very important because in the healthcare system, such as Namibia, what we've noticed is, especially in the outpatient department, we have patients that constantly come into the outpatient department simply for follow-up of hypertensive, diabetic, and epileptic medications, right? So what this does is it causes a huge burden on the healthcare sector because you have over 200 patients in one day in the medical outpatient department that are all waiting. Some of them, perhaps 50% of them, have normal blood pressure readings, normal AGT, and all they need is a represcription of the medication they're already on. So what an advancement in technology in the healthcare system allows us to do is it automatically allows that a patient from wherever they are is able to go to the nearest clinic, and at their nearest clinic, they are then able to say, all right, I am here, I am a known hypertensive, I have diabetes, I have kidney injury, or whatever the case is. They present to their nearest clinic, which hopefully is only maybe a couple of meters or a couple of kilometers away from where they live, as opposed to an actual hospital such as Onanjoke Hospital, Katro Hospital, or whatever the case may be. And they are then able to access patient portals with prescriptions through the nurse or healthcare worker at that clinic, who is then able to make their results or their BP readings or their glucose readings available to the medical doctor stationed at the hospital or wherever they may be, who is then able to say, all right, the BP reading is fine, the HGT is fine, the patient has no complaints, and the nurse is able to give their overall examination of the patient, and the doctor can then enter into the system and say, continue prescription, can continue to prescribe for another 4 months or another 6 months, or whatever the case may be. Hospitals are still facing a continuous high influx of patients, particularly in this particular situation where we have the lockdown. So you have patients coming into hospitals unnecessarily. So in that particular case, this is very important because when you have over 200 patients sitting in an outpatient department waiting to be seen by a doctor, only to be told your blood pressure is fine, continue your medication, and you have a situation like now where you have COVID-19, you don't have any social distancing, that becomes a problem. So instead of people coming to the hospital to be treated and managed and to be afforded better health care, they are then coming to the hospital to contract other illnesses, which is very, very important to consider. Because as far as possible, as healthcare workers, what we are trying to do is to ensure that we are doing no harm, because that is a part of ethics. So when we have patients coming in with a high influx in the outpatient department, we need to ask ourselves, especially at a time like this, what can we do to address these particular concerns? Pharmacy systems, also very important, is that this allows pharmacists. So when we talk about technology and the advancement in technology, instead of a medical doctor prescribing my treatment in accordance to what I believe is best for this patient, and then sending, because what happens now is I see a patient and I automatically write a prescription for this patient in their card, their health passport, which the attending nurse will then take in a box to the pharmacy. If the pharmacy has a problem with the prescription that I've written out, the nurse has to bring that prescription back to me. For example, if there are drug-to-drug interactions or whatever the case may be, the nurse is then compelled to bring that particular passport back to me, who then needs to make corrections. However, with patient portals, with the advancement of technology, the future can see healthcare introducing systems whereby prescriptions can be sent electronically to the pharmacist with the patient details, such that the pharmacist is able to see, all right, you have prescribed an ACE inhibitor for this 23-year-old patient 2 months ago, so the patient is already on an ACE inhibitor, and now you have prescribed another drug which is contraindicated with this ACE inhibitor. This should not be the case. Kindly make this correction, and I will then be able to see it automatically on the patient portal and adjust this prescription quickly and send it back to the pharmacist. So not only are we, because remember when we talk about quality of healthcare, time is very important. So when you make a patient wait for 6 hours to be discharged, simply because they are waiting for their passport that has gone to the pharmacy, we are not practicing quality healthcare. So quality healthcare means time management. Quality healthcare means utilization of information and knowledge as far as possible. So a pharmacist's role is not only to dispense medication, but their task is also to ensure that as far as possible, we, the doctors, are not prescribing medication that's contraindicated, are not in any way harming patients knowingly or unknowingly. All right, that's very, very important to consider. Automated dispensing systems would be the ultimate goal in a healthcare system, as this would mean that eventually less staff would be employed within the pharmacy, as tasks would be more automated yet reliable. Now, this is obviously a little bit controversial because at the same time, we're trying to promote employment as far as possible. So if you automate too much, at the same time, then you're increasing your unemployment rate, which is obviously quite a controversial point and very, very debatable. And so it's important that in any advancing system, when we talk about the future of healthcare, it is important for us to understand that we do need to balance the future of healthcare and an advancement in technology in the healthcare system adequately with humanity, with ensuring that the economy flourishes, and that is ensuring employment as far as possible, especially in a population with 2.5 million people. Now that brings me to my point that I love discussing. I would like to mention these points as brief as possible because I know that I did tackle these particular points last time, but I am also aware that there are people that are present today that were not present at my first speaking engagement with Phoenix Med. So I would like to tackle these. Quality healthcare, if you hear Esperance saying that my aim is to ensure quality healthcare for all in Africa, these are the things that I'm talking about addressing. The doctor, the nurse, the pharmacist, the patient, the patient's family and community, and the government. That is the best way that I can summarize quality healthcare. So when we talk about the doctor, what is my responsibility in healthcare? Very, very important. I'll try and give 1 point for each because time is not on our side. Very, very important. As a medical doctor, when I diagnose a patient with hypertension, with diabetes, with HIV, or whatever the case may be, I am the first contact for this patient. So my role is not simply to diagnose and send the patient away. My role is to educate the patient. Now, this is very important because a lot of healthcare workers miss very, very vital opportunities to educate their patients. And unfortunately, sometimes that first interaction might be the only opportunity your patient ever has to understand what hypertension really is. If we were to ask ourselves, how many of our patients in the internal medicine or outpatient department in the internal medicine department actually know what high blood pressure really is? They don't. They don't. If you were to take their reading, they rely on you to tell them that 180 over 90 or over 100 is high. That means that healthcare professionals are not doing what they're supposed to be doing. Patients need to be educated as far as possible to understand their conditions, even in a basic level, such that they understand what is my condition and what do I need to look out for in the condition that I have. So if you have a hypertensive patient that does not understand what an emergency it is when they begin to have altered vision and they begin to have a throbbing headache and they begin to have chest pain, then you have a problem. So somewhere, healthcare workers are not doing what they're supposed to do to educate patients. And then we have the nurses. Now with nurses, it's a similar case with doctors whereby health education comes in. When you are the only person or the only healthcare worker that this patient is ever going to see within the first few months or first few weeks of their diagnosis, you need to understand how important it is that you take your role very seriously. So I need to educate patients. I need to ensure that the patients are educated as far as possible, such that they are empowered to take control of their own health. Then you have the pharmacist, whose role, obviously very, very simple, is if a patient is going to present themselves at a pharmacy, to educate patients on, look, these drugs that you are taking might have these adverse reactions. Please look out for these. If you do have these adverse reactions, please report to your nearest doctor, your nearest clinic, your nearest hospital as soon as possible. Then we have the patient. And I love this particular point because when we talk about a healthcare system, people always think that we're only talking about the doctor, the hospital, the government, which is very important to address because patients need to understand their role in healthcare and how critical their role really is. So if you are a patient and you have gone home and you are pregnant, it is important for you to understand that when I do not feel this baby moving, and it has been 2 days, it has been 3 days, I'm not feeling this baby moving, it's not normal. And I need to present to the hospital. I need to inform a healthcare worker. Because I have had scenarios whereby I have had patients come into the hospital and they'll tell you they haven't felt a baby move for 3 months. And then they will tell you that their grandmother told them that the baby's just sleeping. So those are the kinds of issues that we need to address at a community level, because these are things that are happening within our system. And as much as we want to pretend that they're not happening, they are happening. And then we have the patient's family and community. This is very important because in every family, whether they are in the rural area, in the urban area, let me not say in every family, let me say plus minus in 90% of families today, or 80% of families today, even if they are in the rural areas, most likely they have at least one family member that is either educated or living in the city. Majority of the time, not all the times, mind you, but in the world that we are living in today, quite a high percentage of families have at least one person, whether they're educated with a simple diploma or certificate or whatever the case may be, they have at least that one family member. That is where the community and the patient's family responsibility comes in, because if you are a medical student, I expect you to tell that family member of yours that is currently 6 months pregnant or 5 months pregnant that she ought to report the fact that she has not felt the baby move for a certain amount of time. If you have a family member that is in the village or in the rural area, I expect you to take responsibility to be able to say that, listen, I understand that a temperature above 38 degrees for a neonate is a warning sign. And so it is important for you not just to tell them, no, it's fine, it's just a cough, it's just a flu. Seek health care attention immediately. Immediately, because remember, what we're trying to do is prevent. We are not only trying to treat, we are trying to prevent as far as reasonably possible. And then, of course, we have the government. The government's role, I would like to think, is to oversee the healthcare system in any country. So their role is to ensure that, number one, we have enough funds. This is how I like to summarize the government's whole role in the healthcare system. When the body does not have enough oxygen going to vital organs, when I say vital organs, I'm talking about the brain, I'm talking about the heart, all right? Those are examples of your vital organs, right? When your body doesn't have enough oxygen or enough oxygenated blood circulating, what your body does immediately is that it prioritizes certain organs. I'd like to think of the healthcare system in any country to be the most vital organ in the body, being the country. So meaning when we don't have enough resources in a country, the government ought to redistribute and redirect those funds towards healthcare. And this is a little bit controversial, but I like to say this all the time. If we only have $10 in the Namibian economy, health deserves it. Why? Because without healthcare, you cannot do anything. Without healthcare, you cannot achieve anything. Without healthcare, you cannot achieve a healthy economy. You cannot achieve an adequate tourism industry. If we say that, yeah, it's quite fair, Esperance, it's okay, but what if we only have $8 million for that year? Well, then a majority of it should be going to healthcare. Because health is a priority. Because healthcare is a vital, not a vital organ, is the vital organ of any country. So I want everybody today to understand something very important. Whether you are in the healthcare system, whether you are out of the healthcare system, you need to understand this. Purpose is intertwined. If you are in the healthcare system, I would like to assume that somehow, somewhere, your purpose has to do with the advancement of the healthcare system. If you are out of the healthcare system, I need you to understand your role in ensuring that the healthcare system prospers, because it is important to understand that just because you're not a doctor, just because you're not a nurse, does not mean that you have no responsibility with the healthcare system. If you are a manager of a bank, you have just as much responsibility within the country's healthcare system to play. Part of that responsibility, as mentioned in the 5 main points or the 6 main points of a quality healthcare system. When I realized my purpose in the healthcare system, it was about 4 months ago. And I remember I was on call that night. Majority of the times when the nurse calls you, I was in pediatrics, in the pediatrics department. Majority of the times when the nurse calls me, she will call, if I'm at home, she will call and she will say, "Good evening, doctor, are you the one on call? We have a patient that just came in, a 7-year-old who's not breathing. The mother says that the child has been fitting continuously for about an hour. Please come." But this particular day, I didn't have that. So the nurse called me and I picked up the phone and she said, "Dr. Luvindao, come now." And she said, "Dr. Luvindao, it's Ward 7, come now." And at that point in time, the first thing that came to mind was, what is going on? But then I heard in the background, mothers, and they were crying. And one of the mothers was uttering and she murmured and she was saying, "God, please, not my child, not my child." So I dropped my phone immediately and I ran, because I stay within the hospital. I ran as fast as I could. And when I got to the ward, the door was closed and there were mothers sitting outside and they were crying like I'd never seen before. I caught a glimpse of the mother's eyes because I knew this mother. I had seen her the day before in the outpatient department. I knew her. I knew her child. I caught a glimpse of her and she had tears rushing down her face. So I ran into the room and I shut the door behind me. And when I got into the room, the child that I had seen with the mother the previous day, he was about 7 years old, he lay on the bed. And at that point in time, the nurse that had called me was busy administering oxygen to the patient. And she was panicking. I checked the vitals and I started resuscitating the patient. I started compression, I got on top of the child, I started compressions, I gave oxygen, started compressions, I gave oxygen, started compressions, 1, 2, 3, gave oxygen, 1, 2, 3, gave oxygen, 1, 2, 3, gave oxygen. There was no pulse, there was no reading. I continued this for about 30 minutes, nonstop. We gave adrenaline, we instituted everything that we needed to do. 30 minutes later, I stopped. I looked at my watch and I said, time of death, 3:40, and I will never forget this day. I got off of the patient. I walked outside and I opened the door, and that same mother looked at me and she said to me, she said, "Doctor, I understand, but I need you to answer this one question for me. I need you to tell me, why me? Why my child?" And she lay on top of my chest and she was crying. And that for me has probably been the most difficult moment I've ever had as a practicing healthcare worker. After a couple of minutes, she got off and she went away and I wrote the death certificate. This particular day for me did one thing. It allowed me to understand that my purpose is far above myself. The healthcare system is about so much more than just me. Any country's healthcare system is about so much more than just you, what makes you happy, what makes you comfortable. And that's why I started this particular story. And this is a true story, by the way. I started this particular narration by saying that the purpose of every single individual is to understand your role in the healthcare system, because it's not just the doctor's responsibility. It's not just the nurse's responsibility. It's every single one of our responsibilities. And until we understand that, the healthcare system, past, present, future, will always remain the same. Always. It would be naive of me to think that we do not have work to do. Every single day I am met by the very fact that I am but a ripple of change in a pool of change. It would be naive of me to believe that we are doing everything we can. We cannot truly say that we are doing everything we can, because if we were doing everything we can, we would make use of the very systems that we work for. But we don't. Instead, all of us run to medical aid because God forbid we end up there. It would be naive of me to think that we are doing everything we can, but it would also be naive of me to think that that change does not start with me. See, African healthcare in all of its majesty was created to serve many gods. So if I were to redesign that oath on my graduation day, I would say, I swear to fight for the system, even when the system fights against me. I swear to fight for change, even when change is not in sight. It would be naive of me to say that we do not have work to do, but it would also be naive of me to say that that change does not start with me. Thank you very much.
Thank you, Dr. Luvindao, for a very informative presentation. It was well put and it was very precise. Thank you very much.
Yeah.
5 questions for you, about seven questions for you in the chat box. But I think some of you might have answered during the presentation, but I'll just read the first one out for you. Okay. How were you inspired to become a health advocate and fight for the Namibian healthcare system?
Yeah. Should I answer them one by one, or will you read all of them?
Okay, let me just read all of them and maybe you can just answer collectively. Yes. That was the first one. The second one is, do you believe Namibia currently has the budget to invest on the electronic side of the healthcare, as you mentioned? Number 3 is, how do you think more Namibians can get involved in global research? Are there already grants and projects in place? Number 4 is, do you have any future goals and plans in fighting for the Namibian healthcare system? And number 5, do you think it is valid and relevant for international medical students and aspiring doctors to get involved in this and help with the Namibian healthcare system? And then the second last one is, apart from the provision of health education, how else do you suggest that a Namibian junior doctor can contribute to the provision of quality healthcare, bearing in mind that we are the most junior members of the healthcare team? And the last one is, don't you think public healthcare professions, social support providers, and administrative or management staff are also a crucial part of quality care? And maybe one of the problems is our healthcare system is that their roles are often overlooked. Yeah, that was basically it from the question side.
Wow, I hope I remember all those questions. I think you might need to assist me a little bit to remind me every once in a while. So I will be tackling as far as possible what I can remember you asked. And then if you can just tick along what I've answered, and then you can just remind me what I haven't answered perhaps. All right. Question number 1. Question number 1, the one that I remember right now that you mentioned, you asked, do you have any, I think, intentions to fight for quality healthcare in future, something along those lines, if I'm not mistaken. I have every intention to continue fighting for quality healthcare. I believe I am already fighting for quality healthcare as far as reasonably possible right now. I do have intentions to intensify what I have already started. I do not believe that I'm doing enough yet. I believe that in as much as we want to start these relevant conversations, we want to put our passion into actions as far as possible. So to answer your questions, my intention is not to start in future. My intention is to start now. I believe I have started. My intention is to continue, but my intention is to intensify because I believe I'm not doing everything that I can to fight for the healthcare system yet. Another question that you asked that I remember is in terms of administrators and how their role is often overlooked 100%. I believe that when I was doing the presentation, when I mentioned the 6 points that are part of a quality healthcare system, I did say the pharmacist and other. I think this particular version didn't have that, just because I acknowledge the fact that the healthcare system is made up of so many more people than just a doctor, a nurse, and a pharmacist. And I have had to come to that realization through health advocacy, because I've realized that there is so much that needs to be done. And because of the fact that it is a team effort, every single person has their role to play within the system. So definitely, I do feel that their role is oftentimes overlooked. I did not overlook it in this particular presentation. I believe that they form a part of a crucial system. And as mentioned before, I did mention also that the healthcare system is not only people in the healthcare sector, also out of the healthcare sector. So every single person is included within this team that needs to fight for quality healthcare. And then another question that I also remember that you asked is in terms of the finances for the technology. I do not believe that, okay. One of the things that I always say is we have to start somewhere. If we are always hung up on the fact that we don't have money, we don't have money, we don't have money, this isn't the right time, this is not the right time, this isn't the right time, 20 years later, we'll be stuck at the same place saying we don't have money and this isn't the right time. Sooner or later, we will need to say, you know what? If we have $1,000, let's invest that $1,000 into the technology as far as possible, even if it means investing into the software the 1 year. The next year, we buy a few of the gadgets. The next year, we invest in the electronic medical records. The next year, it doesn't have to be a one-time thing. It doesn't have to be that today the Minister of Health must announce that today we have totally done away with paper trails or paper records of patients in the entire country. That's unreasonable. That's unreasonable. That's not going to happen. But we have to start from somewhere. And that's why we have committees that are able to not only advocate for these things, but sit together and understand how can we achieve these things. Because remember, the first step in change is to identify where you want to go. That's the first change of the change cycle. You need to understand where you want to go. Once you figure out where you want to go, the next step is understanding who you want to get there with. So building a team. So finding a team of like-minded people that say, okay, we need to achieve this change. How are we going to get there? And then the next stage is saying, how are we going to get there? Where are we going to get the resources? And like I mentioned before, if it comes to a point whereby we need to redirect funds and say, we need to take funds from here, 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 and here, to say that, listen, health is important. Why don't we prioritize health for once? For once, just for once. I believe that we can get somewhere. So I think that if we take all of these things into consideration, we definitely can get to a place whereby we start from somewhere. Yeah. And then another question. Do I remember any other questions? I don't think so. Please remind me.
There is one of the role of the junior doctors in improving the healthcare system. Yeah, apart from the health education that we mostly do. Yeah.
I am a junior doctor myself. So let's start there. I'm a junior doctor myself. I am a junior doctor. I have walked into rooms. I've been invited to meetings with specialists, cardiovascular surgeons, pediatricians with over 30 years of experience. And I'll tell you the truth, just between the two of us, I was shaking in my boots. Because at that point in time, I'm thinking, ooh, okay, should I really be here? But then the other side of me clicks in that says, Esperance, you have the passion, you have the dedication for this. And there's a reason why you are here. There are certain things that only you can do, whether you're a medical student, whether you're a nurse, whether you're a pharmacist, whether you've just graduated. There are certain things that only you can bring about. There are certain changes that only you can bring about. And so even in you being a junior doctor, you need to understand just how much power you have, because even if you are a junior doctor, you still have a mouth, you still have a heart, you still have a passion. You can stand and say, this is not right. This is not right. There are many times that I have had to stand confidently with boots shaking and all, but still confidently and say, listen, the way you treated that patient was not right. Listen, we need this drug. This is important. How do we get this drug? Listen, it's been this and this number of months without this medication. This is important. We cannot say that we are a functioning health facility if we do not have these drugs. How do we achieve these things? And at times it will mean rubbing some people up the wrong way. Unfortunately, that is a part of it. As long as you do everything you do with respect, you can achieve change. There is nobody that is irrelevant or whose position is too junior to impact change, because I have had specialists and seniors and even people way above me, my own lecturers, that have come to me and told me, Esperance, you inspire me. There is no age or experience for that. Anything else that I missed?
Yes, there was a point. Do you think it is valid and relevant for international medical students and aspiring doctors to get involved and help in the Namibian healthcare system?
Yes, definitely. We have a lot of foreign trained medical doctors that are working here where I'm currently working. We also have a lot of foreign medical students. When I say foreign, I just mean they're training in institutions outside of the University of Namibia, because I studied at the University of Namibia and I completed at the University of Namibia as well. And their role is not any less than anybody else. They are healthcare workers just as much as the rest of us. Their role is just as much. And I definitely believe that I like to think of it this way. If you were fortunate enough to go outside to study and get a different perspective on healthcare, count yourself fortunate that you were able to see a different perspective. And my wish and my plea is that every single one of those people, whether students, whether doctors, whether specialists that have gone out to specialize, will have the mentality to come back into Namibia and say, this is what I learned in my time out, and this is what I want to implement in Namibia because it works so well. This is how we do things in Namibia. But hey, listen, when I was studying, I saw them do things this way, and it really works very well. I saw that the mortality rate decreased. How can we implement this here? So I believe that their role is not any less significant than anybody else. Every single one of us has our role to play. And I definitely believe that we standing together, once again, it's teamwork. It's a team effort. If everybody can stand together and offer their 2 cents, it comes together and it creates this perfect puzzle.
We have 2 more questions from Anthony. He's asking, how is the health insurance structure or scheme in Namibia?
Pardon me, please repeat that.
How is the health insurance structure or scheme in Namibia?
All right, by health insurance, he means medical aid and all of those, right? Mm-hmm. All right, so the health insurance system in Namibia is divided. Okay, let me put it this way. Medical aid is unfortunately right now afforded to those that can afford it. I know that sounds very layman, but what that basically means is that unfortunately, as mentioned before, above 80% of our people are served by the public sector, which means 80% of these people cannot afford medical aid. Medical aid is afforded by about 17% of the Namibian population. And it depends. If you work in a public facility, in a public sector, so for example, if you work for the government, so in a public hospital, in a government hospital, that is, you will then be afforded medical aid under the government. It is part of the package. If you work for a private sector, it is then your responsibility to acquire medical aid for yourself. There are various medical aid schemes. I myself make use of NHP, I'm not sure if you have it. I'm not sure where the person that asked the question is from. So I'm not sure if they know NHP, but I particularly make use of NHP. I have found that it covers quite a wide range of services, and it has satisfied my needs for the past 2 years that I have been making use of it. So I definitely believe that in as much as we have a lot of options, we have all these schemes available for people to choose from, and then we have different grades, right? Most of them have bronze, silver, gold, platinum, etc. And obviously the level depends, the level is determined by the amount of money that you contribute per month, and that level will obviously also then determine what you have access to. So for example, my particular medical aid covers for all of my hospital admissions, covers for dentists, all these things, but another medical aid, for example, a bronze or a silver option, might not cover exactly the same. So it really just depends. Unfortunately, though, we are not at a place whereby even 50% of our population can afford medical insurance, which is very sad, which is very, very sad, because I believe that, let me restructure that. I believe that if the healthcare system and healthcare workers did what they were supposed to do, we can actually send medical insurance companies out of work. Because I believe that the quality of healthcare in the public sector should be so good that ultimately we don't even need medical aid, because the service in the public sector is exactly the same as it is in a private hospital. I know it sounds like I'm dreaming, but I'm a dreamer, bear with me. Yeah.
And the last one is, what are your thoughts in instances where the input of the health practitioner is limited due to a lack of political will in improving the health system?
Please repeat that.
What are your thoughts in instances where the input of the health practitioner is limited due to the lack of political will in improving the health system?
Okay. That's very, very interesting, very political question. Very, very political question, but you know me, no filters, nothing. The system is going to be what we allow it to be. Now people, especially young people, are starting to realize just how much power they have. They're realizing that if we talk about something enough, people are going to start listening. If we tell people we are not happy long enough, they will start listening. If we couple this with action, people will be forced to listen. When you are in a country, and this is not only talking, we're talking in general now, right? I'm not targeting a particular country, a particular government, or whatever the case may be. When you are in a particular situation, in a particular environment where there's lack of political will to assist with the improvement or the progression of the healthcare system, it is up to you to make them listen. It is up to you to make them bring about change. And I know that that's easier said than done, because I myself am in that particular situation at times, whereby I feel like there is a little bit of resistance in terms of how far can you really go, Esperance? You are just one person. Like I said, sometimes I feel like I am just a ripple of change in a large pool. But one thing that I will not stop doing is I definitely will not stop tabling these issues. I will definitely not stop bringing to attention those that need to be brought to attention, because that is where we start off, making people understand that we are no longer comfortable with where we have been. People before, the generation before, may have been comfortable with the healthcare system as it was. People before may have been comfortable with the fact that it's okay for a hospital not to have your anti-epileptic medication. It's okay. It happens. No, it's not okay. And if the previous generation was okay with it, we're here to introduce this current generation to you. We're not okay with it. And we will make it known that we are not okay with it. And if we need to bring suggestions of how we bring change, we will do it. Because remember, we're not just hot-headed. We actually understand that, and that's the good thing about coupling. One of the things that I always tell people is, as far as possible, try and couple passion with education. It will make you the most powerful person in the world. So that is one of the reasons why I love the fact that I actually went on to complete my medical degree, because my passion for change in the healthcare system can now be coupled with education. And I can stand as an educated person and say, listen, I understand that you're saying this and this and this. If you're saying this drug is not available, can we then ensure that this alternative is made available? So you can't pull a fast one on me, because I know what I'm talking about. So it's very important. If you're going to bring about change, number one, be passionate. Number two, speak out. Number three, try and ensure that as far as possible, you are educated in the sector that you want to speak out about, because people listen to you when you have a voice. And a lot of the times, education amplifies your voice. Yeah, I hope I answered that. Any other questions?
No other questions. So in the absence of any other questions, thank you, Dr. Luvindao, for a very brilliant presentation on the overview of the Namibian healthcare system in terms of the past, present, where we want to go. And I agree with you in most of the cases, especially the electronic patient system. It will really make a huge difference, especially to us, the health workers. So I would also just like to thank everyone for attending. Thank you for making this session possible. And other than that, I'll give the chair back to Paulus to please wrap up the session for today.
All right, thank you very much, Laina. Thank you, Dr. Luvindao. Quite a wonderful talk there. I think one of the most important things that she said was that it's very important for us to identify key gaps in the healthcare system and just jump in and save and do what we can, especially for us junior doctors or aspiring junior doctors rather. So just before I wrap up, I'd just like to add that for those who are attending and those who are new, we have upcoming events, particularly on the 23rd to the 25th of September. We're going to have a 3-day seminar. It will be on basically international learning from Phoenix Development Partners, that is Namibia, the UK, particularly Wales, and also Zambia. In this seminar, our lead on Phoenix Project, Professor Judith Hall, will introduce our fellowship community, and we'll also have various speakers from Namibia, from Cardiff, and Zambia. And of note, we'll have one of the key note speakers will be our own Vice Chancellor, Prof. Kenneth Matengu, who will also be one of the speakers. And so, yeah, please keep a lookout on our social media pages. We are on Instagram. We are also on Twitter and Facebook. And we're also trying to record these sessions and have a YouTube channel running. And so, yeah, just keep out and please do take part in our activities and events. Of note is that every Saturday of the month, we do try to have a formal event. So next time it will maybe be a speaker from Zambia or a speaker from Cardiff or any other speaker that we try to get. And that every month we also try to have a social event on the last Saturday of every month. So please do keep out and participate on that. So with that said, and if we don't have any other questions, thank you very much. Thank you for joining us.
Dr. Sharma has a question. Dr. Sharma?
Oh, okay.
Dr. Sharma, the floor is yours.
I'm not sure if you can hear us.
Okay. And someone asked if the next question was answered. Yes, it was answered by Dr. Luvindao. Dr. Sharma is not responding, so thank you everyone for attending. Yeah.
Yes, how are you guys?
Back.
How are you? I can hear you now. I was muted from that side.
Oh, okay.
I was muted from that side, but I can. I think you can hear me now.
Yes, we can hear you.
Yeah. Thank you very much, colleagues, for this very presentation. And since Professor Hall is not here, let me just thank the team. You have really done a great job. And our speaker, Dr. Luvindao Esperance, she has really spoken with passion and really presented progressive things that we want to see. That's why the platform is dedicated to you, colleagues, so that you can navigate it through. I would like to ask one question here for Dr. Luvindao. She have mentioned, and I want to remember the first talk that you have hosted. The colleague from Cardiff was talking about Aneurin Bevan, a person who had already started NHS in the UK. And today I have listened to Dr. Luvindao talking about Dr. Libertina Mathila. And for me, I consider her as our Aneurin Bevan. What I want to say is that Dr. Luvindao has spoken about something that the University of Namibia and Cardiff Pharmacist project have embarked on also. This is electronic health passport. And that is electronic health passport, which we consider not only a unique number like they have for NHS, but also to use biometric of a thumb of a person, so that any person you just press on a device or a tab, then the profiles comes up. Because we have many people who can later would like to tell a different number of another person, for example. But with a biometric, there is no way you can check. Everything is linked to your profile through the biometric. And this is what discussion we want you to also bring about. I would like to appreciate also Dr. Luvindao that she presented about what we have done so far as a country in terms of health sector. We have concentrated a lot, she have mentioned, on curative. And we partially a little bit abandoned the real philosophy of the Namibia health sector is primary health care, which is prevention of diseases. Therefore, it's also through this platform we can learn from each other from different countries, UK, Zambia, Namibia. How can we strike a balance between curative, preventive, innovation, so that we can afford accessible and affordable quality healthcare to the public. At the same time, I would like to say I have already identified that we have Anwar Bevan in the UK, we have Dr. Labatina Mathila in Namibia. But next time, let's hear who is the health champion or medical champions in Zambia. We want to collect those names. And I want to say that maybe the colleagues here, the co-host Luvindao, I want us to assist you guys so that we can call upon Dr. Mathila to speak on this platform. I know she will be able to agree on that one. With those with those very words, we still have a vision that this platform will grow from strength to strength, so that one of the day you should run really a course which should receive CPD point both in Namibia and in the UK according to the qualification of the speakers, so that we gradually will really have that platform going. And let's be preparing for our big event as mentioned here by the co-host or the co-chair on in September. Thank you very much.
Thank you, Dr. Sharma. The points were all taken, especially inviting Dr. Amadila to one of our events. I think it's very important. Paulus, back to you.
Okay, with all that said, I should just thank Dr. Sharma for joining us. Thank you, Doctor, for always supporting us, for being here, and also giving us advices on how we should go further. I believe there is no more questions, and I'll just say I would like to officially conclude this session. Thank you everyone for joining us tonight. Dr. Sharma will convey our well wishes to Dr. Luvindao. I think she had logged out earlier, but yeah, thank you very much and good night, everyone.
Thank you, guys.
Bye, Amanda.
Bye.